Welcome to another episode of I Wonder, Doctor.
I'd like to talk about menopause and ask a basic question. Should a woman seek hormonal treatment for it?
You and I, we've sat in these chairs a lot of times and gone over a lot of issues. My guess is of all the ones we've ever gone over, there is probably as much concern of getting treatment as there is of not getting treatment, maybe even more for some reason in America.
There is, and there's reasons for that, and I'm going to address those reasons in future videos.
Yeah.
But let me give you an overview of this subject. For one thing, a woman's hormones peak in her early 20s, as do men's.
Yeah.
And then for both men and women, those hormones decline over time. And these hormones are very important for health.
Yeah.
For example, estrogen is so important for the health of bones, arteries, cognitive function, and the same could be said about progesterone and the androgens, testosterone, for example, in women.
So if a woman doesn't have enough estrogen, as an example, what, she's not going to be capable of keeping bones strong?
Yeah, a lot of women. And this is a significant risk to her health.
Yeah.
Now, there's a few milestones in the story of this decline. I mean, the most common one that people think of is when the sex hormones drop so low as the woman's periods cease, somewhere in the early 40s to mid-50s. Yet that's not the only milestone. Prior to that, as early as the early 30s, a woman could cease producing sufficient progesterone to balance the estrogen. That can lead to, for example, overstimulation of breast glandular tissue, leading to breast density, which is a risk factor.
So that happens because a woman continues to produce a lot of estrogen, but she can't produce enough progesterone, and that imbalance is bad.
That imbalance can lead to a risk. And, you know, it's an ideal time for young women to be alert, as we're going to cover in future videos, to that decline that can take place and that imbalance that takes place. And then let's look at the other end of the spectrum. The decline of hormones doesn't stop with the cessation of periods. It goes on and on into the elderly women, and that decline is highly consequential to them. They can lose bone strength, they can lose muscle strength, they can wind up in depends, in walkers, and wheelchairs.
Yeah.
These are all very important subjects to elderly women, I can tell you that. So, from my perspective, having dealt with women in menopause for the 22 and a half of the 45 years I've been practicing medicine, I am a very significant proponent of treatment with hormones. Now, it's crucial that it be done elegantly, safely, and to reduce risk as close to zero as possible, but so much is known at this point that this can be done.
Maybe it's something like this. Like if I've got an appendix that's in trouble, I have to go get an appendectomy. There are some risks to getting it, but the risks of not getting it, well, those are a certainty.
Yes, that would be a way to look at it, and this is what I teach to doctors. There may be risks associated with treatment with hormones.
Yeah.
There's a near certainty of difficulty if you don't.
Great. Well, thanks. There are more videos in this series available in our weekly school. Click to join. It's free.